Hello everyone, I'm Dr. Frankie, the health expert ambassador for FemFresh. And this month for Women's Health Wednesdays, I am busting some of the most common myths about contraception. There are loads of myths and very strong opinions floating around about contraception. I think it's really important that when it comes to choosing contraception, that everyone has all the facts so they can make an informed decision rather than just hearing one side of the story from their friend or family member or favourite influencer on social media. When it comes to contraception, what works well for one person might not be the best choice for someone else, and one contraception may cause loads of side effects for someone but might actually be the perfect contraception for someone else. So it's really important that you find out what works for you. So what are some of the most common myths? Myth number 1, the pill will make me gain weight. A possible side effect from both the combined oral contraceptive pill and the progesterone only pill is increased appetite, and for 1 in 10 users that may lead to some weight gain. But actually 1 in 10 women will also lose weight when taking this form of contraception. It is a bit of a generalization and a myth to say that if you take the pill you will gain weight. You may be 1 in 10 women who do, but often it's just increased appetite without actual weight gain. Myth number 2 is that you need to have a break from the pill and have a withdrawal bleed once a month. So the combined oral contraceptive pill, or the pill, was historically designed to be taken every day for 21 days and then have a 7-day break. And this was designed so it kind of mimicked the natural cycle of having a period once a month. But actually, there's no scientific evidence that says you have to have that break. It's perfectly safe to take pills back to back without having a break, just many women like having a bleed once a month. Of course, the bleed that you get on the combined oral contraceptive pill isn't actually a real period. It's called a withdrawal bleed. The combined pill contains both estrogen and progesterone, and the progesterone maintains the lining of the womb. When you have your 7-day break, that causes the lining of the womb to break down and you get a withdrawal bleed. But it is perfectly safe to run 2 pill packets back to back because the pill actually keeps the lining of the womb thin. So it's not like more and more blood is building up on top of each other. It is just maintained as a thin lining. That is often why the withdrawal bleeds are lighter than a normal period. Myth number 3 is that you absolutely must take the pill at the exact same time every day, otherwise you risk getting pregnant. This is a myth, but I understand why it's a myth. It's important that you take the pill every day, and having a time of the day where you remember to take your pill, whether that's when you're brushing your teeth or on your bedside table, increases the likelihood that you'll take it every day. Actually, if you take it within 12 hours, there is no drop in efficacy of the pill, but it is better to take it every day because you're more likely to remember it. So for the combined oral contraceptive pill, you can take it any time of the day, providing you remember to take it every single day. The progesterone only pill, however, or the POP or the mini pill, is slightly different, and each brand will have a different safe window. So some brands, you've only got a 3-hour window, otherwise the efficacy drops, and other brands may be up to 12 hours. So please check your own pill packet for the guidelines on how to take it safely. Myth number 4, my friend got depressed on the pill, so that means I'm gonna have mental health problems on the pill. This is one of the biggest myths and one of the main reasons that people come off the pill. Not all contraceptives suit everyone. And of course there are also lots of different brands of each kind of contraception. One form of contraception or one particular brand of pill may suit someone really well and they get no side effects, but someone else may metabolize the pill differently and experience side effects. Now, mood changes can be quite a serious side effect from the pill, and that's often the reason that many people stop taking the pill. However, that doesn't happen to everyone. So it's like what I said before, that someone can leave a really bad review of the pill, but you might get on with it just fine. Just because someone you know has suffered with mood changes or symptoms of low mood associated with the pill doesn't mean that you will. If you do suffer side effects, then please consult your own doctor, and also consider switching brands. So there are lots of different types of the same pill, and the side effect profile can be slightly different, so it's often worth trying a different brand before you rule out that form of contraception entirely. And myth number 5 is that you shouldn't take the pill for too many years because it can cause infertility. This is probably the most common myth I hear about the pill, and I understand why it's such an anxiety for so many women. There is no scientific evidence that taking the pill over a long period affects fertility, and many women will get pregnant within weeks to months of coming off the pill. However, it can sometimes take a few months for regular periods to return. The average is around 3 months. If your period doesn't come back within 3 months of stopping the pill, then it's worth consulting your own doctor about it. There is a common misconception that a period cycle or a menstrual cycle is supposed to last 28 days. Actually, it can vary hugely between individuals. In actual fact, cycle length can vary between 21 days and 40 days and still be considered normal. And it might just be that you don't have a period every 28 days, but because you're on the pill for many years and you're used to having a regular bleed every month on the dot, then there is this expectation that that's how your natural period should be. Also, lots of women may have irregular periods and they went on the pill so young and they never got a formal diagnosis of this. And then when they stop taking the pill, often at an age when they're starting to think about pregnancy, they realise they've got irregular periods and then blame the pill, when matter of fact, this actually might have been present before and just masked by the pill. It's also worth remembering that fertility does decline with age. So if you are a little bit older, it might just take a little bit longer to get pregnant. I've talked mainly about the pill when it comes to fertility. The only contraceptive form that has proven to delay fertility is actually the injection. So if you are someone who is thinking about getting pregnant in the near future, the contraceptive injection may not be the best choice for you. It doesn't cause any long-term problems with fertility, but it can take sort of 12 to 18 months for the injection to completely leave your system and for your ability to get pregnant to return to its full capacity. So that is something to bear in mind. But when it comes to the pills and the coils, there is no proven effect on fertility. And the final myth is that you can only take emergency contraception the morning after having unprotected sex. This is a myth, and actually there are 3 different forms of emergency contraception. There are 2 morning after pills. They are called Ella-1 and Levenel. Levenel has a 3-day window where it's effective, and Ella-1 has up to 5 days after having unprotected sex where it's effective. It's better to take it straight away the morning after, but if you don't manage to get hold of it the day after, there are still options for you. But it is more effective the sooner you take it after unprotected sex. And most people also don't know that you can have a copper intrauterine device fitted as a form of emergency contraception. So the copper coil, this can be inserted up to 5 days after unprotected sexual intercourse, or up to 5 days after the earliest time you could have ovulated for it to be effective. So that is a third option that lots of people don't know about. And if you use the intrauterine device as your emergency form of contraception, it can be left in and become your regular form of contraception. I hope you enjoyed my contraceptive myth busting episode today. I would love to hear whether you knew all of these myths, or if you have any more myths you'd like me to bust, please feel free to leave us a comment in the comment box below. My name is Dr. Frankie, I'm here with FemFresh, and we will see you in the next video for our next Women's Health Wednesdays. Bye now.